Hey folks, Dr. Joe again. This week we're going to actually do some tagging on some fawns, try to give some new insights on some things that y'all may have missed out on, or I'm always learning from others as well. So we're just going to do a few routine things here. I know y'all are probably used to it, but we're going to do a few things that are pretty interesting. First of all, we're going to do a quick physical exam. We've talked about that before, and I like to start from the nose and go to the tail. So let's look at the nose, let's look at the mouth, make sure we don't have any ants. I like to look at the mouth and make sure it's moist, and you can actually feel the moisture. It's nice and pink. We look at both sides. Also, it has two eyes, so we want to make sure to look at both eyes. They're not hazy or foggy. We don't have any ulcerations. The pupils are a nice size. We want to take a look at the ears. We're really looking for ants or any problems, debris or anything like that that could be left on them. Okay, next thing I want to check for going down the body is we're going to check for dehydration. Something to really check is kind of like how a mama kitten or a mama cat picks up her kittens. Pick them up between the shoulders there and let go. See how that snapped back pretty quick. This guy's already nursing, so I'm real happy with that and real pleased. We're going to look at the front feet and the back feet. These guys are already dried off, so we don't have to do any iodine or anything like that right now. So that looks real good. We're going to just kind of clean that off. Okay, next thing we're going to look at the belly button. Looks like Steven's been doing some fawns already. This one is a little bit wet and weeping, got a little blood to it. Mama's been licking on it, trying to keep it clean, so we're going to go ahead and use 7% iodine on this. I'm just going to go ahead and I actually spray it directly on the belly button and then rub it in on there. This will turn that umbilical cord to leather, and we want to prevent any entry from the soil or anything like that. Alrighty. Next step, let me take this off. We're going to use Equalizer C20. Yeah, we were fortunate and blessed to get the C20 before it back ordered. So we're going to give 1 cc in the mouth. I'm just going to give this slowly. She's actually nursing the syringe, so that's good. Then we're going to give a cc to 2 cc's of B12. I usually do 2 cc's because they'll spit some of it out. It don't taste as good, does it? Okay. Okay, and then we're going to use a half a tube of our Enable Fawn Boost paste. The concentrations of the antibodies, the bacteria, as well as the dextrose in there is high enough that we only have to use half a tube per fawn. And another trick, instead of sticking it down the back of the mouth and squirting the back of their mouth and them choking on it, we run it between the cheek and gum, kind of like the little red man right there. Levi Garrett, your choice. We'll do that on both sides. This is very palatable, tastes real good, and it's real sweet, and it's just a good rush of sugar to these guys. We kind of fill them up like a chipmunk. Okay. Thank you. Okay, next we're going to go ahead and get this guy ready for a tattoo, and I'll show you, we're going to actually poke holes first, because we're going to get a little blood from this. When we do that, then we're going to show you how to do a little blood glucose test. We've been talking a lot about hypoglycemia and fawns. How do we check that? I'll show you a quick trick real quick. It's real easy. Track 2. This is designed specifically for small animals. One unique thing we kind of did here is kind of serendipitous is we actually tattooed. We did everything. We put ink on the gun except for the last tag because I want to get fresh blood instead of inked blood. So we're going to kind of squeeze that and get a drop of blood right there. And that's all it takes. So we'll turn around, you're going to watch this for a few seconds, and it tells us we're 70, so our blood glucose is a little bit low. Below 60, I get a little bit worried, so about 100 to about 180 is where I'd like to see it. So that little Enable Fawn Boost is loaded with dextrose. We'll check that here before we set this little baby loose here in a minute, and just check and make sure. Okay guys, this is about 3 minutes after we did the first glucose, after we administered the Fawn Boost paste. If you notice, our blood glucose is 161, so it's doing what we need to do. We're trying to have happy, healthy fawns, so it'll go nurse mama now. Y'all have a good one. God bless you. What I like to do when I'm tagging, everybody has their tagging techniques different. I always learned that I'd live a longer life if I said women are always right, so we actually tag the females in the right ear. I put a little iodine on both sides. Then we'll tag the ear. Left-handed. A little bitty ears, don't they? Gonna have a little holler. After we tag that, I want to go ahead and spray it one more time with iodine. I'll make sure that's seated real good. Okay. If y'all have any questions, respond to it. Give us questions or comments. We'll do everything we can to help you out. That's fall number 1. Let's go get another one.